Now, this is something that we've been meaning to do for ages and ages on the Guide Liverpool, putting your questions to someone who really does understand and know what they're talking about with COVID-19. The crisis is ongoing, really dreadful news every single day now in the UK. You know, we lost 1,800, over 1,800 people yesterday. This is a pre-recorded interview. We're going to put it out on Facebook in the full duration, also on YouTube as well. So just so you know, we're pre-recording this on Thursday afternoon, and we know how fast things change as well. I'm with Professor Frank Joseph. Now, Frank is based in Liverpool. He works at the Countess of Chester Hospital, also director of a brand new private healthcare company called Dam Health. Professor Frank Joseph, thank you so much for joining us first off.
It's my pleasure, Jay. It's nice to be here.
So tell us about you before we begin. We've got loads of questions to put to you that have come in through our Instagram audience. Tell us about Dam Health, first of all.
So Dam Health, as a company, is something that me and some of my colleagues and friends have set up because we recognize the need for people to have access to testing, which is really the one thing, other than the vaccine, of course, for COVID-19, that allows us to continue to find a level of safety in terms of day-to-day living while the pandemic is ongoing. I mean, it's like I say to people, COVID-19 is here. It is causing a lot of ill health and, you know, as you said in the introduction, a lot of mortality and morbidity, which is people dying in hospital. And the only way that we can try and calm this pandemic down and try and bring it to an end is by making sure we're testing as many people as often as possible so that we can try and contain the virus. The challenge with the virus is that obviously if you get symptoms, it's easy enough to go and get a test with the NHS and check and confirm that you have got COVID-19. That then prompts a series of responses where you know that people will be keeping an eye on you, you know what to expect. If you need antibiotics or you need hospitalization, you can act early and you can help people who've caught it and will need that level of intervention. The bigger challenge we face across society and across the world is the people who have the virus but have no symptoms, and therefore walk around not knowing that they're carrying the virus and therefore can spread it to more vulnerable people in their vicinity. And that's the bit that we cannot get complacent about. And the only way that we can help people to restrict that spread is to test as often as possible. And there's all kinds of strategies for that. And DAM was set up initially to try and help to provide as many options that we can around testing so that people could be made aware, so they could be safe, and try and live a life that had some semblance of normality. You know, I'll give you some examples. So people, for example, just before this current lockdown happened, you know, we had university students in Liverpool who just wanted to go home. They were from overseas, and you couldn't get a test that allowed them certification to fly home. And we were there and we were able to help. And it was a really satisfying thing to be able to help these young people just trying to go home at a time when, you know, all they wanted was to be with family, but to be with them safe. We had people who wanted to spend a little bit of time with elderly relatives over the Christmas period, for example, when it was allowed to do that. But they wanted that additional security to say, I don't have this, and I'm not going to pass it on to my father, my mother, my grandparents. And so we had people coming in for tests before they went to Christmas dinner for a little bit of time within their small support bubble. So there's so many ways in which testing actually allows us to do what we can do. Obviously, the lockdown is the lockdown at the moment, right? And you shouldn't be traveling. You've got to stay safe. You know, hands, face, mask, stay indoors. That's what you have to do at the moment. But when you do need to go and do something, you got to test before you go out there and do it.
Frank, tell us about the different tests available, because we know there's a PCR test and there's also a lateral flow test. Now there's been lots in the press lately about lateral flow testing not being as accurate as first thought. Just talk us through what these tests are, and in your opinion, as a professor, which one is best and more accurate?
Okay, so in terms of testing, the PCR test is the gold standard. Okay, so what that means is it gives you the most accurate answer, but we've got a resource implication when we use the PCR test. So the PCR test requires you to have someone else to get an effective sample, stick like a cotton wool swab through the back of your throat or back of the throat and your nostrils, and then that sample has to be sent off to a lab or taken on site and run in a machine that can then give you the answer as to whether you have the virus or not. So the key area or scenario where the PCR is so important is when someone is symptomatic and you really want to know whether they have COVID-19 or not. Because if they have COVID-19, your alarms have to be up and you got to be prepared to look after them and make sure that if they're getting sick, you can do something about it. Now, the PCR test is also kind of the gold standard when you're talking about traveling across countries or you're trying to maintain the strictest level of not allowing the spread. But like I said, it takes time, it takes personnel, it takes resource. So it's not something you can do every day and get a response in 15 or 20 minutes, right? In kind of contrast to that, the lateral flow tests are ones that you can self-administer, okay? So a lot of the strategy around lateral flow testing is more frequent, quicker response. So you're trying to do volume. What you want to do is catch whatever you can as quickly as you can by testing as often as you can. And that's where the advantage of the lateral flow test comes in. Yes, there is reports of reduced accuracy, and we get that. There was actually a paper published by a group in Oxford just today, which basically talks about comparisons between different makes of the lateral flow test brands. And basically, they do pick up infections, but they tend to pick up infections when you've got a little bit more virus in your system. So you may not pick it up early, you'll pick it up when it's kind of got enough in your throat or nose to pick it up. But what it allows you to do is check twice a week, 3 times a week, check every day if you want to be completely safe, and you will capture someone who might be carrying it without knowing, and then you can isolate them and do some contact tracing and stop an outbreak. So the advantage of the lateral flow is you can do more people in real time and slow down the spread. The advantage of the PCR is that it gives you more accuracy, but you can't do large volume because it's got that much resource implication and there's a time delay.
So the lateral flow then, which we've been seeing the impact of lateral flow within Liverpool with the fantastic mass testing initiative that was started here, it does work. It does contain the virus and let you know if you're spreading that virus to someone vulnerable.
Yeah, absolutely. So, there's always that little bit of accuracy that you have to account for, but it's like I said, it's about the volume and the numbers, and as long as you capture the volume and the numbers, you will see the transmission go down. Okay. And that's the advantage. It's better than walking around not knowing what's going on, because that's what we were doing before the lateral flow testing came to Liverpool, isn't it? Is we just assumed we'd wear a mask, we'd keep our social distance, but actually, we didn't have even that level of scrutiny. Whereas what lateral flow does is it gives you that additional layer of security. And then if you are really symptomatic, then you need to go and get a PCR test. So there's layers of what you can do for safety.
So they work hand in hand. Listen, we've got tons of questions. I know I haven't got you for long. We put this on Instagram. We asked people to get in touch. And as you can imagine, tons and tons of people have done so. I'll rattle through some of these. Just give us an answer for each, please, Frank, if you could. Okay. Rachel Baby, 83. Are there any long COVID clinics in Liverpool?
So there isn't, I don't think, as far as I know, an official long COVID clinic. There are people who are starting to take an interest in long COVID. One of the places that I know has actually officially set up one is Leeds. And I'm actually going to be speaking to one of their lead therapists in a couple of days to try and get some insights. There are so many things that people are reporting in terms of ongoing fatigue, ongoing symptoms around aches and pains. And we're still learning as we go along. And I think as people start to bring that information together, we will see more support services coming through. But as of now, there isn't an official long COVID clinic. I think most of us are still in the NHS, at least, struggling at the moment and facing the challenges of the sick people in hospital that, are occupying hospital beds and physician time.
And I presume as well, and we've all read about this, not that much is known yet about long COVID. This is a new virus, so we don't
absolutely
know the long-term effects.
Absolutely. So some places are starting to take the lead on trying to pull together some of those resources and pull that information together. But as of now, on the NHS, as far as I know, in Liverpool, there isn't anything. I know there's various online sort of private providers who are starting to talk about providing long COVID support clinics, etc. But there's nothing official at the moment.
Okay. Juliet wants to know, how do you know what vaccine is best? There are so many. And do you get a choice as to what you will be vaccinated with? It's a good question.
That is a great question. It's a question that a lot of my patients ask me. The answer at the moment is the current 3 vaccines that we have approved. So that's the Pfizer vaccine, the AstraZeneca vaccine, the Oxford AstraZeneca vaccine, and the Moderna vaccine are all considered to be effective and safe. That is why they've been approved by the MHRA, which is the Medicines Health Regulatory Authority. They all provide protection. They have slightly different schedules as they were published. Obviously, there's the change in government policy at the moment in terms of the first dose and then the second dose. But the data tells us that after the first 10 days, so 10 days after your first dose, you get about 89% protection. That's what the data tells us, and that's the line that our chief scientific officer and our national leadership are following. We can debate whether that is the right thing or the wrong thing to do. There's arguments both ways. My plea and my statement to my patients, relatives, anyone I come across is, it doesn't matter which vaccine you get, just get the vaccine when your turn comes. And the uptake has been fantastic. People are turning up on time, booking in, and the rollout and the government effort to try and do this, as much as we can, it is still phenomenal. What we mustn't forget is there are countries in the world where they haven't even started yet.
Okay.
And that's the important thing.
Lots more vaccination-based questions. Robin on Instagram, what happens when the majority of people are vaccinated with that first dose? Will we see restrictions lifted maybe?
Again, I wish I could tell you. I suspect what we will try and do is when that first dose of vaccine is done for everybody, I suspect there will be a degree of easing. I think the real determinant of that will be more to do with the R rate in the community, which is the transmissibility rate. You see, almost all the lockdown decisions are all based on the impact that the spread of the virus in the community has on people getting sick and ending up in hospital. What we're trying to do is make sure there's enough room in the NHS to look after those who are unfortunate enough to get really, really sick because of the virus. And that's really going to be the determinant.
It leads on to Woodsy, also on Instagram. Should people who've had that first vaccine still take precautions? Do we still do things like wear masks, social distance after that first dose?
I absolutely cannot stress how important that is. So that's very important for the specific reason that at the moment, the vaccine is designed, and the purpose of the vaccine is for those of us who do get the vaccine, it doesn't stop us catching COVID-19. You can still get COVID-19. What the vaccine does is it prepares your body to fight the COVID-19 so that you don't get sick with it. You don't end up with an illness that means you end up in hospital. So what we don't know whether the vaccine does or not is whether it reduces transmissibility. So what that means is if you get it and you've been vaccinated, are you less likely to pass it on to someone else? So until we know that, and there's a large-scale trial following up a lot of the frontline staff who've had to have their vaccine, so they're being followed up to see if the transmission rate comes down in those group of people. And if that proves right, then we've got another glimmer of hope that the vaccine not only protects the individual, but it can also protect other people a little bit more by not spreading it as much. So until that happens, and until we know that, whilst the vaccine may protect you as an individual, it doesn't stop you giving it to someone else who hasn't had a vaccine yet. So the lockdown is there for a reason. It is to keep the vulnerable safe. Even if you've had a vaccine, you must still follow the rules of the lockdown and keep the social distancing and keep that going.
Okay. Ali has been on Instagram again. Still have no sense of smell. It's been since April 2020. When will it return? Because obviously that's a big kind of symptom of COVID-19, isn't it?
Yeah, I wish I could give him an answer to that one. Unfortunately, I just do not have an answer to that one. I think we're learning as we go along. We're still in early days, and that's all I can say, is that keep your eyes and ears open to the literature, in the scientific literature, and keep looking out for people in your area who have an interest in long COVID, who will be keenly following these things and hopefully come up with some answers and solutions for us eventually. But at the moment, I can't give you an answer to that one.
Okay, just on that, if someone has got symptoms of COVID right now or they're experiencing real sickness at home, what advice would you give them to get through? Or maybe someone's worried about a loved one who might have COVID and they're struggling a little bit alone. What would you say to that person right now?
So if they're struggling alone at home at the moment and they're symptomatic, obviously the first thing to do is make sure you call 111, and then they will direct you accordingly to your GP or wherever your hot hub is going to be. So you'll have a hub where you can go for a test. It has to be planned. It has to be scheduled to confirm the diagnosis. You then, depending on the diagnosis, your GP is usually able to guide you on what you can do. There are lots of programs around. So as an example, there are COVID oximetry programs that are being run. So what that means is that GPs can hand over a pulse oximeter. So it's a finger probe that tells you what your oxygen levels are, and they will be able to measure your oxygen levels to see if they're dropping, so that if they're dropping, then you can escalate quicker. Symptom management is fluid hydration, paracetamol, that kind of thing. And then you've got, antibiotics may be needed. So if you're starting to get symptoms, hopefully you'll be able to get your GP or GP at bars to support you with a course of antibiotics that can get delivered to you. But the simple things are paracetamol for symptoms, fluid hydration, try and eat as much as you can. If you start to feel sick, ask for help so that if you need hospitalization, we can deal with it early and do something about it.
So I never knew antibiotics treated COVID-19.
So the antibiotics aren't to treat the COVID-19. What happens is because of the upper respiratory symptoms, sometimes people end up with a cough and they get additional bacterial infection. And so we do treat people, because one of the things that causes the problems with the lungs is that you get inflammation in the lungs. So COVID causes inflammation, but once you've got the inflammation, you also get other bacteria that jump on board. And that's where the antibiotics come from. So it's not to treat the COVID, it's to stop the lungs from getting worse from other bacteria.
Okay. Really good question, and one that we all desperately want to know the answer to. Paul85 asks, when will COVID-19 be eradicated, if ever?
I wish I could give somebody an answer to that. There is no crystal ball that's going to give us that answer. It is around for a long time to come, I think. The vaccine will allow us to function a little bit better once the whole world is vaccinated, or at least a significant proportion. Remember, this is a global pandemic, and even if the UK is vaccinated completely and we're all, got our immune system boosted by it, the challenge remains that there may be variants that start in other countries. Other countries will still potentially need vaccinating after we've completed ours. Testing, I think, will be around for a while to come until, you know, we reach that stage in the world, because we don't live in one city, we don't live in one country. We're an international population. It's a global world now, and it is a global pandemic. So I think it's here for a while to come. I don't think there's anyone who can predict that for us.
Okay, and just you know, we've seen today events like Glastonbury is cancelled now for this year. Travel is kind of feels limited again in terms of what we can do. I know what you were saying about Dam Health and giving those tests before you travel. What do you see the kind of short-term future looking like for us in 2021?
So I think if I could look beyond this immediate lockdown, which still is, you know, it still needs to carry on, because I know from day-to-day work and from my colleagues that the hospitals are still seeing an increasing number of COVID-19 coming in sick. And whilst it's you know, optimistic because the R rate is appearing to come down in the community, slowly but steadily in most areas, that is going to take some time to translate into hospital beds becoming more available and less COVID ending up in hospital. Once that is seen, I think so if I was going to put this, three things will contribute to our decision about when we come out of this, right? One is going to be the R rate in the community and keeping that down. The second is going to be looking at what is the NHS resource availability to look after sick people. It's only when we've got that under control. And the third bit is going to be how many people have we vaccinated by that point in time. Once you put those three figures together, then you can start to think about what are the gradual things we can do to try and ease people back into, you know, what we consider to be normal life. You know, things like kids going to school, things like traveling abroad, things like eating out and stuff. I mean, you know, we've all got to choose our priorities. As a physician, my priority at the moment is health, but I'm a father with 3 young kids. I want to see my kids go back to school. You know, I have friends who have lost jobs, friends who are, you know, trying to do what they can, working from home and homeschooling and all the rest of it. It ain't easy for anybody out there, but lives matter and we've got to save them first. And then, you know, we've just got to build slowly and find our way back. All I can say is that I'm proud to work in the NHS, and I'm proud of my colleagues and everybody in the NHS that's doing what they're doing at the moment. And, you know, I'm trying to do something slightly different from the NHS to try and make sure that those of us who aren't sick are still doing our bit to keep the NHS functioning for the people who do need it.
Okay. Professor Frank Joseph, founder of Dam Health, also doctor at the NHS. Thank you so much for taking some time and chatting to us today.
Thank you very much, Jay. Take care.